Hi, Jamie Davis here from the Nursing Show at ANIA 2015. I wanted to thank all of you for checking out this program, and we're talking about nursing informatics. So we're talking with Dr. Brenda Kulhanek here, and Brenda, you know, it's interesting that you were talking about coming in from the clinical side and driving informatics. So really pulling informatics into the clinical setting rather than pushing it from the informatics side. Now, you do have a background in informatics as well, but so why don't we first off talk about a little bit about your nursing background so people can understand where you're coming from.
Sure. As a nurse, I've worked in home care, adult care, pediatrics, peds ICU, and for a vendor doing software sales. I guess that's not so much nursing, but probably a nursing career of 10 to 12 years.
Excellent, excellent. So tell us a little bit about this initiative. You moved from nursing informatics back to the clinical side because you thought that it was needed to drive informatics and change in the technology.
Mm-hmm. What we find and what all of healthcare finds is that in order to make changes in your patient outcomes, you really have to have clinical measures that you're looking at. You're looking at your quality measures and things like that. And if your IT is driving that, you can't always get the change that you need because you're not linking the quality to patient care, you're linking it to the technology. So I left my position as corporate director of clinical informatics, and I had a lot of IT teams under me, and I moved over to be corporate director of clinical practice and education. So in that role, I'm able to look at the clinical side of things and then really nicely integrate the technology in, and we find that the nurses do a better job. It makes more sense to them when you approach it from the clinical side and then merge in the technology.
Well, and that's one of the reasons that it's so important to have nurses involved with healthcare informatics, because really we need to have that connection between the clinical side and the informatics, the IT side.
Yes, and it's taken me a little while to get my clinical knowledge back up to speed again after being in IT for years and years and years, but our nurses really don't approach patient care from the technology side. They approach it from the clinical side, and if you don't blend that in, so our competencies have not only the clinical practice but also the technology part in it, so that it really crosses all parts of their patient care, so it makes sense for them.
So what are some of the things that you'd like to see other organizations, other healthcare facilities out there implement that you've seen some success with in your area?
I think it's going to be important to drive the changes in your organization by what your clinical need is versus by what the newest, latest module is that your vendor has implemented, because you may be implementing some new gadget, but your organization has a crying need for improving quality scores. So you've just invested millions of dollars and resources into this gadget that really isn't what you need to report and get your reimbursement from. So I think organizations really need to take a look at who's driving the bus in their organization, and then really integrate and merge the clinical process as well as the technology side of things, so that our caregivers are really seeing a very seamless patient care. So we never teach lung sounds here and then the stethoscope over there and never link the two. We really need to keep those two together.
That's an interesting way of putting it, but I like that. I mean, you really need to join the two and make them one. And hopefully that's what other nursing informaticists are doing. But you're right, we need to be driven by clinical practice.
Mm-hmm. Yep, we've even talked about merging into simulation, where you would work on the mannequin, do the clinical process, then turn and do your computer process, so that you're really not only analyzing how well they're doing with that and the areas of efficiency or inefficiency, but they're building muscle memory into their process. So you don't not only have muscle memory for the patient care, but for the technology as well.
Well, great. I think it's awesome to talk about all these topics in nursing informatics. I'm learning a lot, so thanks so much for coming in and chatting with me today.
Sure. Thank you.
And I want to thank all of you for checking out this segment here from ANIA 2015 in Philadelphia, talking about nursing informatics. If you want to find more segments like this one, remember to head over and check out all of the segments, both on the channel you're watching right now, or if you're not over there already, over at NursingShow.com.